So this is one of the staff and patient vending machines, and here again you can see it's just completely full of ultra-processed snacks, sugar-sweetened beverages. Truly shocking.
It's not about labelling ourselves as vegan or vegetarian or flexitarian or omnivore. It's simply about choosing to build all of our meals or most of our meals from the foods that are consistently proven to benefit human health.
Hospital food for me is something that makes me feel really angry. I work in one of the biggest hospitals in this country, and we are still serving processed red meats, a group 1 carcinogen as classified by the WHO in 2015. So that's sausage and bacon and deli meats. So really I think we need to look very carefully at the food that we serve in hospitals and move to promoting healthy plant-based diets.
70% of my work as a GP is managing chronic diseases, and I think if people followed a plant-based diet I could probably put my feet up. It would probably save the NHS in many ways, because the NHS is really struggling. So I think it really is the future for our country.
When you're in hospital, you're really sick. You need the help of doctors and nurses to get you well. So it makes sense to be able to use the food that you're eating as part of that journey to recovery.
If you want your patients to get really well, get them on a plant-based diet. Low processed food, make sure they're drinking enough water.
There seems to be a real difficulty in shifting the emphasis in hospitals on food. People are very concerned about restricting choice, but we're doing no one any favours by giving them food that we know to be harmful, and we wouldn't do that with anything else. We have smoke-free sites for a reason, because tobacco smoke kills our patients. Well, so does poor diet. It's the leading cause of mortality and morbidity.
So to my fellow health professionals, I'd like to say to look more broadly at the factors that are playing a part in the health of your patients.
Most of the people living in the UK have never been educated on what healthy food actually is.
We're constantly fixing people who are broken, and what we need to do is to really invest in preventing disease before it occurs.